So my name is Dr. Githinji Gitahi, and I'm the Group CEO for AMREF Health Africa, based out of Nairobi, Kenya. And as we discuss the big issue of vaccine equity, we must always remember that vaccine equity has multiple dimensions. And the first dimension is, of course, access to vaccines. And that has been a global approach to ensure that global governments, global architecture, assist those low-income countries to access vaccines through scaling up vaccination, ensuring access through the COVID vaccine facility, ensuring that intellectual property rights are temporarily suspended to ensure more manufacturers to scale up production. All this is going on. But we must also remember that vaccines don't save lives. Vaccination saves lives. And when finally the vaccines are available and they have landed in the country, in Africa, we have also vaccine equity challenges in country. And those challenges arise from lack of access or poor access to the health system. So number one is that you have people who live extremely far from the health system. And if the vaccines are facility-based, you need to ensure that those people, the demand is mobilized and they are able to access the vaccines at the health facility. Then you also need to ask yourselves, how do you store the vaccines? You need to ensure the health system is capacitated enough to actually store the vaccines at the right temperature, which is what we call the cold chain. Then you need to engage communities to overcome skepticism and hesitancy, which has arisen from all the communication coming through social media on side effects, on the speed of production of the vaccines, and ensure that communities that need to be protected have the right information to be protected. AMREF Health Africa works with communities to overcome these challenges, works with governments to overcome these challenges, and works with our partners like yourself, individually or institutionally, to overcome these challenges that need to be overcome to ensure that it's not just equity to access vaccines, but equity to get vaccinated in your country, in your community, in the neighborhood where you live. This is really the issue that we need to consider.